My name is Anil Dugal. I'm an assistant professor in the Division of Plastic and Reconstructive Surgery. I first got introduced to plastic surgery by working with a hand surgeon up in Canada. She was meticulous, so it was an area of surgery that involved a lot of anatomy and detail and a lot of innovation. And so for me, that was what really drew me into plastic surgery, and there's a variety. You get to work on all parts of the body. So I thought that's a great way for me to combine interest and challenge of learning all the anatomy and interest in innovation. Most of the patients that I see are hand trauma patients, either through plastic surgery or orthopedic surgery. They tend to have complex problems from accidents. We also see a lot of patients that have arthritis and have problems that are considered more elective hand surgery based, such as carpal tunnel and Dupuytren's and trigger fingers. So we see a lot of compression of nerves and nerve problems, and then we see a lot of bone-related problems through injuries. Yeah, I first got interested in medicine because I was a patient. So I think if you have a personal experience, then it sparks an interest. And for me, as a child, I had a problem, and there was doctors that were very helpful and kind, and so that kind of promoted my interest in medicine. And I often tell patients that we all become, or we all are patients at one point in our lives. I think seeing the patient as a whole is my biggest forte. So not just seeing the patient as a problem, a specific hand problem or a specific reconstructive problem, but looking at the patient as a person and seeing how the problem that they're having is impacting their lives. And if you think about it, there's nothing more human than hands. The way that we interact with our environment is really with hands. And so I try to respect the fact that that is precious. And I think that's what I bring to the patient.